This is Jeff Breedlove with the Georgia Council on Substance Abuse, here with the third installment of the Neil Campbell report as we focus recovery in COVID-19 and the importance of COVID-19 to the Georgia recovery community. And we are so thankful to have the Executive Director of the Georgia Council on Substance Abuse, Neil Campbell, lead us in this effort. And Neil, today we wanted to talk from a federal perspective. You know, Congress has done 2 packages already, really 3, and they're calling the next effort phase 4, and everybody believes there's going to be a phase 5. And it's so important that Congress address recovery. I wanted to ask you to tell our viewers what we need to know about Congress funding and recovery.
In 5 minutes or less, right, Jeff?
In 5 minutes or less, no.
Yeah, it's good to be with you today. And, you know, I always want to talk about this. First of all, I want to say that the last 6 weeks we have had recovery town halls every Wednesday at noon. And out of those 6 recovery town halls we've had, 3 of them had current members of Congress on. So that's been really, really great. So thank you for your efforts in that. But because one of the things we've learned is that they have opinions about this stuff. It's just that we don't get in their faces enough. And I think if we don't have, if we're not a constituency that gets into our federal representatives' faces a lot, that they're going to forget about us in this COVID epidemic. And as we know that people were dying of overdose at record numbers, I used to start my talks out by saying, how many people died in the Vietnam War? Well, it's 58,000. And how many people died of overdose last year? 72,000. So now they're saying, well, we've had as many people die of COVID-19 as we have in the Vietnam War. So it's been fast and it's historic, but it's going to go away. And addiction, overdose, all of those problems are still going to be there. So we need to have some thinking and some advocacy at the national level about phase 4 and probably phase 5 of the funding that's coming down. So I've got a couple of ideas around that. I don't know if you want to talk about those now or if they're...
Yeah, give us some legislation we need to be aware of, some marching orders, things that folks that care about recovery can know about.
Yeah, I think we talked yesterday about the Mental Health Parity Act, Mental Health and Substance Use Disorder Parity Act of 2008. Won't go into that again, but that's something that needs attention in terms of enforceability and accountability. Would like to see Congress come out with some strong statements about that and maybe some enforcing legislation because states have still not picked that up. The Substance Abuse Prevention and Treatment Block Grant, which Georgia gets about over $50 million a year. We would like to see that increased by at least $500 million nationally. So we have states and what that does, the Substance Abuse Prevention and Treatment Block Grant is money that comes through the Department of Behavioral Health and Developmental Disabilities for prevention, treatment, and recovery supports. And so it's really important funding. We'd like to see that increased. We want to see the Recovery Community Services Program, RCSP, Recovery Community Services Program. It's a network. We want to see that expanded. Georgia, you may not know this, George, put this in the back of your head. Georgia was one of the very first recipients of an RCSP grant back in 1999. That was with Recovery Consultants of Atlanta. So it's good funding. It has started some amazing programs around the country. It's for people like us who are in recovery. It's a great funding stream. We'd like to see that done. So that's just off the top of my own. We also, most importantly, HR 2466 is the State Opioid Response Grant Authorization Act. And why that's important, Jeff, is we've got about $19 million worth of that money just in Georgia. It was $500 million on the first go around nationally when President Obama was still in office. And then when the transition to President Trump, we got another $500 billion. We want to make those, if not permanent, we want to make them at least those funding streams for the next 4 or 5 years. And I believe that Authorization Act says 5 years.
It does say, 5 years is what it calls for.
Yeah, so that means we would be able to pay attention to with prevention, with prescription drug monitoring. It funds a lot of good things. And so treatment and recovery support services.
And we've had Congressman John Lewis and Congresswoman Lucy McBeth from Georgia publicly co-sponsor that one. We've had a commitment publicly, and we want to do it to Congressman Buddy Carter, and so we anticipate he'll be a co-sponsor. But we want every member of the Georgia delegation in the House and our 2 U.S. senators to be co-sponsors. We want everybody seeking office for federal office in Georgia to commit to support this as they take their message to Georgians.
Yeah.
This needs to be bipartisan and unanimous, and it is absolutely a bottom line for the recovery community. If you want the privilege of representing Georgians in recovery in Congress, you need to support this effort right here.
Yeah, and the way that it does, trickle down, if you will, to the ground level. We had and on our call earlier today, we had a recovery coach talking about the work that she's doing in the community and how it's frightening to see people are scared. People are detoxing on their own. People are afraid of going back to prison if they don't if they can't get a hold of their probation officers. I mean, people are out there wanting to connect, and that funding is good funding that allows for coaching and other services for those folks who are struggling.
Neil, if I can, I'd like to say I related to that share that Jamie made.
Yeah.
I've literally had that anxiety and fear. I'm on probation. When COVID broke out, I didn't know, there was no communication from the office to me.
Yeah.
I can only imagine folks that maybe don't have the resources I have, what they were fearing. And it's been a real fear for me in the real world. It's not theoretical. That what if there's a snafu because of COVID-19 and there's a knock on my door, I'm pulled over and they read my license plate and I've done nothing wrong, but I am very concerned about those exact examples, and I had that exact fear.
Yeah, I think a lot of people were nodding their heads about that. But I also want to say, so these are folks that we're currently working with and that we know about, right? What about the folks who are coming into recovery or who need recovery services that have never had to before because of the anxiety level, because of the suicidality? People are lonely, people are scared, people are losing their jobs, they're feeling hopeless. I think we're going to see a percentage of the population with mental illness and substance use disorders go up. And so we cannot forget about us when this stuff is over, when we can finally get back to, I know it's not going to be normal, but we get back to the non-physical distancing and back to our lives.
And you're so right about that, Neil. Today at 1 o'clock on the RCO report, Catherine Newcomb from the Change Center, a great RCO in Albany, a hot spot in Georgia, Albany in Southwest Georgia, she shared literally that same thing, that as good a work as the Change Center is doing as an RCO, they know it's a much smaller number of people they're coming in contact with, and what they're concerned about is the much larger number that's going to be evident later that they're not coming in contact with. That's such an important point you made.
Yep, and there's evidence that people are using their stimulus checks to either spend it on alcohol or drugs, or they're not doing healthy behaviors with it. It's just there's a lot out there that we're going to have to be dealing with. And this, let's be honest, we've never had mental illness and substance use disorder services have never been funded to the extent that they should have, and that people need to have more access to services, and we need to do some stigma reduction as well.
And Neil, we'll end on this point. You're absolutely right that we've never had this pandemic and we've never had the funding the way we need it to be. And maybe if there's anything good to come out of this pandemic, it will be the realization by our elected officials that they need to fund the serious issues of mental health and substance use disorder recovery to the levels that are appropriate, because it's absolutely a reality that's going to be the next wave of COVID-19, of these secondary medical issues.
Yeah, and I want to speak to the recovery community and say, know your legislators and vote. That you're going to have, we're developing surveys, surveys for our elected officials. We're going to ask them to commit to certain things. And so we, as a recovery community, if we want to become that constituency of consequence, we have to know these issues. We have to hold our politicians' feet to the fire and make them take a stand on this. Is recovery important to you? Is it important to know that people who are in recovery have better mental health, that we live above the poverty level, we pay our bills, we buy our homes, all of that stuff is important. So just $1 spent on substance use services and mental health services going to be worth so much more. It's not even quantifiable in the future. So people, the recovery community, we owe it to ourselves to get empowered and to get organized and to get loud.
Well, Neil, thank you very much for your time today on the Neil Campbell Report, talking about the need for Congress to support the Georgia recovery community. We'll be back on tomorrow with another edition. Neil, we thank you so much for your leadership and your time. And as I always say, recovery is real. Neil?
Jeff, thank you.
Thank you.